Good afternoon and welcome to the weekly COVID-19 Directors Live Stream with HHD staff. I, Dr. Melissa Sheldon, will be today's moderator. The one-hour live stream pertains to the information about COVID-19 response and an opportunity to ask questions. After the updates, we will address your questions. And if you do have a question, please select the My Question tab located at the top right and post your question. Also, a friendly reminder, there's about a 10-second response delay via the web. Also, if you are using your desktop to listen to the live stream, we do suggest maybe using headphones for a clearer sound. I want to welcome Stephen Williams, our director.
Hello, everybody. Welcome to our COVID-19 interactive session. I started to say update, but you probably have more information about COVID than you ever wanted to have. I apologize for the change in time. As you know, everybody has a boss, and we were working with UMMC to open up another testing site and on the east side, and they were willing to do that. And of course, our boss wanted to have a press conference this morning for that opening. Consistent with last week, I want to give a couple of shout outs. First has to go to the folks that are out at the testing sites. I know you tried and true folks. I happen to be at the testing site on Saturday out of Del Mar, and my staff in usual form challenged me to start checking people in. I think they were really teasing, but I actually suited up probably more than I had to, and actually started to check people in. So when the numbers came in and I saw the numbers, I made sure I let our IC structure know that I checked at least 10 of those folks in. And of course, I did have an opportunity to go to Butler and to visit with those folks too. And I'm forever grateful, because I know just kind of being on the front line that out there day after day, and the sun is getting a little bit hotter, is really trying, and I'm grateful for y'all doing that. Also, we've added another strategy over the last couple of days. Actually started, I think, Friday and continued through the weekend. We in the health department are teaming up with folks from the fire department to go out and do inspections in the nursing home. And you ask, well, why are y'all doing that? Well, there have been a number of cases in certain nursing homes and living facilities. And what we're really trying to do is to make sure that people are practicing not only good hygiene, but also engaging in social distancing and proper wearing of PPEs as they're dealing with our most vulnerable population. I want to give a shout out to Dr. Gail Lowe and Courtney Purse and our EPI team. And I cited those two people because I think I witnessed them going out and have conversations with one of the fire captains that actually have gone out with some of our EPIs to do this work. I want to start by just kind of reviewing our policies related to people performing certain duties, and I'm going to be a little structured in this. I want you to know that all staff need to be willing to perform duties that are assigned to them. Certainly you sign on to do a job, a routine job, but as a health department, you know, when we're in an IC structure, you'll be given assignments that's not necessarily the same as what you're doing on a daily basis. Please understand that when you're given those assignments, that as essential employees, it is a requirement that you actually respond to that assignment. Your deployment is not really optional. All employees are considered Tier 1 for the purpose of deployment. And I ask that you review the essential employee policy and our passport if you have questions about that. But I want to underscore something that I said in the last couple of live streams, and that is that when we ask you to go out, we're not asking you to go out and conduct those activities in an unsafe environment. you will be given whatever PPE that is required to do that function. Then I started out by telling you about my workout at the sites. It's interesting because at Del Mar, the level of PPE was actually above that was actually required for that particular activity. And when I went to Butler, folks had on gloves and masks, which was really the basic requirement for what they were doing at the time. And the reason for that is that when folks were being checked in, people had to leave their car windows up, and so there was really no contact between individuals and the staff. When you're asked to go into other situations, such as the nursing homes or whatever, as appropriate, we are, equipping people with N95 masks as appropriate and gloves and whatever other PPE that we believe is necessary. And all of this really is checked out through the CDC and their recommendations regarding those levels of activities. So the bottom line is, we're not asking you to really perform a function in an unsafe way. I also had this debate with one of my neighbors who worked in the oil field, and we were debating whether or not you had to have a B-fit test that you were an N95. He told me he had been out there for like 20 years, and then I should actually listen to him. And we went back and forth, but I said, well, somebody's telling me this, and this is what I'm doing. He said, well, I'm telling you, I worked out there for years, and that's only when we were using breathing apparatus that we have to have that level of tests. But I'm, saying that we will go by what our folks that are doing the tests are telling us to do. Another issue that came up is if COVID-19 becomes a seasonal issue like flu, will there be a restructuring of our organization to handle this issue in our community? Really, we're looking at how to handle COVID-19 as a part of our normal operation in anticipation that the virus will actually impact our operations for a long time. And the second part of the question was, will it be mandated that employees wear face masks in all HSD locations? Right now it is. I think that we should, be on the safe side, except when you're in the office, particularly when you're interacting with other staff members. I have to acknowledge that I have with the staff, with some without face masks. Sometimes I'll let it go, sometimes I'll chastise. But interacting with each other and not really social distancing. It is really not usual for us to talk to each other and interact. Wear your mask, but also continue to social distance. There's so much that is unknown about this virus that I really don't want you to take a chance. We cannot afford to lose members of our staff through COVID-19. Be that, they have 14 days or really working with you through an illness or whatever. So why don't we do what we're asking everybody else to do, and that is social distance, engaging, and hygiene, and covering your face with either a mask or some kind of cloth. I think that that's the minimum that we can do. But start to really remind each other to do that, because it's important that you stay healthy and take precautions. I probably wouldn't push it as much if we had a vaccine, but there's no vaccine. And we're finding out that this virus is actually impacting the body in a variety of ways that's not necessarily good. You've heard talk about blood clots, thirst. They thought it was just affecting the lungs, and find out that it has had a negative impact on almost every major organ in the body. And with that, I just say, just not take any chances. So for me, I just think it's better to be, on the safe side with this. I'm going to answer another question while Valerie's coming up to answer a time question. Some employees are on grant contracts that will be expiring in 60 or 90 days, and they're being deployed for COVID-19 relief efforts. If there are any updates about employment status or an opportunity for short or long-term extension to finish the job with the current pandemic. You know, the policy is that you will receive 60 days notice prior to the grant ending. And during that time, everybody is encouraged to look for other opportunities within the department or the city of Houston. There are grants and non-grant positions that you may qualify for, and they may be related to COVID-19 response. Our HR Clients Relation Manager, Melody Walter, will provide assistance. You know, it's my intention for folks that are in the response to continue that employment as long as you are performing, you know, that job to a certain standard. I think that, you know, one needs to be mindful of whether or not they're really carrying out those responsibilities. You know, what I've noticed is that doing, you know, when grants are ending, that managers and supervisors really make extra efforts to try to keep people employed if they feel that their work habit, their work history is really up to par or even exceeding that. I like to remind people, especially when people are interviewing for jobs that are internal, that, you know, you're really kind of at an advantage and disadvantage. Because if I've been working with you over a period of time and you come and you interview with me, you might tell me stuff. But remember, I've already experienced you. You've already interviewed. So do the best you can to fulfill your ongoing responsibilities. I ask that you also, you know, be mindful of your interactions with the staff people and express a willingness to actually get the work done. I'm going to ask Valerie to come forward to talk about taking personal time for testing.
Good afternoon, thank you, Stephen. So one of the questions that what I'm trying to do, just so that you know, is whenever you submit questions that we haven't specifically answered during the video chat, or the question continues to come up, Dr. Shelton will send them to me and I try to address them during the next chat. And we also post these questions and the responses on the morning minutes. One of the questions that's come up is, can you take personal time when you go, if you are going to be tested? So if you are asked to leave work, we typically will tell you to contact your provider, and your provider will determine whether you should be referred for testing. So you will need to take your personal time if you do follow through with that, or if you just decide that you feel like you need to be tested. However, if you are quarantined, we remember that the emergency paid sick leave policy will apply to you if you're quarantined. And so that allows you to get the vacation time that you may have taken or sick time that you may have taken back, as long as you were requested to quarantine by federal, state organization like the City of Houston or your provider. You will get that time back. One other question that came up was, well, the question continues to be asked about timesheets, and we put the information out in the morning minutes, but I know that this can be very confusing, and some of you are just being deployed and you're asking that question. If you are really not sure once you read the information, please contact your Unico Marshal. We can try to work that out. We want to make sure that your time is allocated appropriately.
Okay, do you have any questions?
Yes. The first question is, can you tell us more about the furloughs the mayor's talking about? Also, if there are going to be furloughs, when can we expect furloughs to begin, and what percentage of HHD employees are affected?
Well, in the past, when we have furloughed, and this is a different administration, we all had furlough. I had furlough, so that affected everybody. But it was over a certain period of time. It's not taken all at once. There are no real specifics on that. The mayor, I think, is just giving everybody a heads up that the city is facing a number of financial challenges. On the other hand, we have been given several $400 million by the federal government in response to COVID-19, and that's outside of when it comes specifically to the health department and to housing. Legislatively, our representatives are working with the federal government to try to get some flexibility in how those dollars are used. I think the city's argument is that because of COVID-19, sales tax has been impacted, which has caused a fiscal challenge for the city. And so therefore, I think that, well, I know what the mayor is advocating for is that some of that money be used to really minimize the negative fiscal implications for the city. So nothing's really been decided. When he talked about it in our department directors meeting, he actually said that it would be next fiscal year, but I don't think that we really know. I know that he will work toward minimizing, any fiscal impact on individual employees. I will tell you though that earlier when I talked about, people really conducting themselves in terms of filling the responsibilities that they're assigned, I think that we have to put our good foot forward as individual employees and as departments, showing that it is okay for the public to have a level of trust in us and that we will fulfill that. When you look at it in context of what's going on in the broader community, you will see that in the nonprofit sector and in business, employees are taking a tremendous hit. You see the lines for food. You've been around the stadium on Saturday afternoons for the last 2 Saturdays. You will see that the streets are really packed with cars going through those food lines, which is an indication that there's a tremendous need out there. And so I think that we're blessed as government employees that up to now, there's been a minimal negative impact on employees. And I think we will continue to work towards that. But we have to show, that we're really working and fulfilling our responsibility in return for that.
Do we resume business as usual on April 30th? And what will that look like?
Say that again?
Do we resume business as usual on April 30th?
The answer to that is no for the city. The mayor says that through May the 30th, we will pretty much maintain operations like they are. Now, what that means for us is not exactly like they are, because we're looking at, adding on mobile units. We're looking at working more closely with the LQHCs. I know that in talking to Solly about the current clinic sites that we might, in fact, take the operation as it exists at Northside and expand that to another location. That's been under discussion. And so that might happen before the May 30th. But in terms of just opening back up as a city and city government, that's not going to happen until May 30th, unless in the next couple of days, our boss says, well, he wants to go back to business as usual. I don't think that's likely because there is a belief that we don't want to open back up too soon. We want to do it in stages. And as a health department, we need to be prepared for opening up just in case there is a second wave.
One of the staff persons does COVID testing at the home sites for patients that have a compromised immune system. Now that flu is coming, are we thinking about doing testing for both the flu and COVID-19 at the same time so we know exactly what the patient is sick of? Or do we have funding for both in the future?
Well, I really don't have the answer to that. I think all of that, I think that people are thinking about that. If you look at the discussion and some controversy around Dr. Redfield, the CDC's director, he mentioned the fact that, it's possible that COVID might continue to fall. And through flu season, so therefore we needed to continue to push, flu vaccines, but also from a clinical standpoint, be prepared to rule out one or the other.
Has the health department begun doing contact tracing?
Yes, we've never stopped.
Have you seen a decline in the productivity since more staff has been assigned to work remotely?
No, I don't know the specific answer to that, and the reason that I think it would be hard to say is because we scaled down services throughout the organization. I mentioned the clinics earlier. We're primarily working out of north side and I think south side of the dental. And there, I can't compare, having a scaled back operation to what we're doing before. Our assignment and my challenge to the assistant directors was to maximize working at home and to do what we thought was essential and minimal. But they're having a mic change.
I just want to say that this is providing us with an opportunity to be creative. I got an email this weekend that the chronic disease staff had actually started, I don't know if it was Zoom or Skype class for the Don Center. They actually had 12 participants. So I think it's given us an opportunity to look at new ways of providing our services that we may be able to continue into the future that can help us be more effective and outreach better and be more efficient.
I think that's a good point because before, either through technology limitations or just being used to the way we've been doing things, we haven't explored a lot of those options. But it's really forced us to really be creative to see how we can continue to do our business. I think it is important going forward because COVID-19 is not going to stop at the end of April or at the end of May.
Are there any plans or arrangements in place to bring testing to the health department, to all of the health department employees?
That's something that I think that we might want to consider. Where there have been situations where there was question as to whether or not people were positive, we encourage people to go get testing. And in some cases, expedited arrangements for that to happen. But I think with the encouragement of employers to actually test it, that's something that we should look at. Our timing on that's going to be really important.
Another one about the COVID-19 testing. Should people be tested for COVID-19 before receiving the flu shot if we don't have any symptoms?
I really don't have an answer to that. That is something that I would really lead to our clinical folks, our medical direction.
And the next question, you actually already answered. It was really about a non-exempt employee that stated they work at the stadium 3 days a week and they telecommute 1 day a week. And they wanted to know, should they be clocking in or should they use city business time?
I already mentioned this. If you're working, and being deployed, they have sign-in sheets for that. I just ask that you ask your supervisor and look at, the procedures that we've actually released on that. I know it's complicated and it gets confusing, but I just ask that y'all stay in touch with your supervisors. And supervisors, if your folks come up with questions that you don't really understand, please call HR, call Valerie, Melanie, whoever, to try to get those answers.
And that was the last question.
How many people do we have?
297 attendees.
Okay, so we're probably less than 100 less than we normally are, right? And so we'll go back to our normal time. I knew that it was a risk that we would, in fact, lose a level of participation with this, but I didn't want to wait another day. And we will go back to our regular scheduled time on Monday. I will encourage my bosses to not interfere with that 10 o'clock sacred hour that we've set aside to have this level of interaction. I encourage all of you to, stay the course with us. I think that more people are beginning to recognize the role that we are playing and with COVID-19. We are working with our community partners to expand our capacity to test. As I said earlier, our folks are going in, to the nursing homes to really do outreach to those populations that are more at risk. We really need to look to the disproportionate impact that COVID-19 is having on African Americans and Latinos, and really take that issue seriously and do more extensive outreach. To the extent that you can help us to really be successful in that effort, I ask that you do so. I actually want you to walk the talk. I think setting an example and modeling is a good way to carry that message, so people will start to take us seriously. All 297 people, I appreciate you joining in, and I'll talk to you at 10 o'clock on Monday morning.
Okay, and Stephen, everybody, just want to say thank you for taking the time to talk to us and providing us updates. And we appreciate all the hard work that the HHD staff is doing for the COVID-19 response. And this wraps up this week's live stream. Please stay tuned for next week's live stream.